Ms. Ng Ling Ling.
I stand in support of the motion raised by the 3 nominated members. In fact, I have no doubts that the government is committed to supporting healthcare beyond COVID-19 pandemic. Looking at the 2023 national budgets that this House supported recently at the COS sitting, health, with a projected total expenditure of 12.59 billion, is only second to defense with a total projected expenditure of 13.41 billion. Where I think the government needs to continue to be vigilant is how this budget is being spent, and more importantly, if it is translating to better health outcomes for our aging population. In addition, I cannot agree more with the NMPs that health for Singaporeans must be a whole of government effort. I would push further to say that it must be a whole of society effort. Let me elaborate through 3 points. 1, supporting our family doctors through the Healthier SG implementation. 2, looking after our frontline workers, especially those in the emergency wards. And 3, empowering Singaporeans with more knowledge and support to manage our own health better. Firstly, on supporting our family doctors in GP clinics, I'm a firm proponent of Healthier SG initiative, having visited various parts of Netherlands, United Kingdom, and the United States a few years back on their healthcare systems to manage increasing chronic disease burdens in aging populations of advanced countries like us. GPs in Singapore, who are in the heart of the Healthier SG movement, have however not been the center of gravity in how our government ensures delivery of good healthcare until recent years. I cite an example of a very hardworking GP in my Jalan Kayu constituency. He has a GP clinic situated at the basement of a HDB block, a bomb shelter built by HDB, and leased out to this clinic for many years. During the COVID-19 pandemic, as a public health preparedness clinic, or PHPC for short, he was given a temporary booth at the vacant void deck at his clinic as his clinic stepped up to help in the administering of COVID-19 tests and vaccination. It was proven then that senior residents could access this clinic more readily with the void deck space instead of the basement bomb shelter, which can only be accessed through a stairway. Singapore Civil Defence Force, or SCDF, could not approve the clinic to install a wheelchair lifter down the flight of stairs. Extending a lift to this basement clinic will need to wait for HDB's lift upgrading program with no definite plan or timeline in sight. With the GP, I appealed to HDB to provide a vacant void deck space permanently to this GP clinic. While the in-principle approval came, we were told that the process from concept drawing to TOP would take another 6 to 12 months. This GP is struggling with the capital renovation costs of about 200,000 he has just received from potential contractors, and he's thinking of giving up. Even if he manages to raise the amount, we were informed that the approval is further subject to agreement by URA, BCA, and SCDF. Help doctors to help patients more and to do administration less. This example I cited is just one of several that I have experienced while rallying GP clinics in my constituency to support Healthier SG so that our residents can start their preventive health journey early with a trusted family doctor as exhorted by the government. More handshakes across agencies under different ministries for a less onerous and time-consuming workflow must be made with a whole-of-government mindset if we want to see GPs embracing Healthier SG to help this multinational strategy succeed. Secondly, looking after our frontline healthcare workers, especially those in the emergency ward. Last week, some of us were informed of a message that some community groups in a western part of Singapore has received from a good public health hospital. It was a cry for help. The message shared that the hospital has been facing very high emergency load with 100% occupancy in the past 2 weeks. ED doctors were operating as fast as they could with admission waiting time increasing and about 100 patients waiting for beds. Their plea is for volunteers to help spread the message to residents to not go to emergency ward unless absolutely necessary and to consult the GP clinics first if their conditions are stable. I thank the government for the various interim strategies announced in this House to provide a valve to the high demands of beds faced by our hospitals, and the long-term strategies through Healthier SG to build capabilities and capacities among our GP clinics. In the meantime, it will be important to step up bolder HR actions to support the frontline healthcare workers. I repeat my suggestion for consideration of employing above establishment with the appropriate HR mechanism in public hospitals to allow buffer for surges and, more importantly, essential rest for the physical and psychosocial wellness of our doctors, nurses, and frontline healthcare workers. Lastly, my point on not only the need for whole of government commitment, but also whole of society actions for maintaining health in our aging population. I would like to make a specific suggestion to exploit faster the telehealth capabilities of not just video consultations, but end-to-end, full-loop remote vital sign monitoring systems for management of common chronic diseases like hypertension and diabetes. Government-funded clinical trials must speed up and extend to private GP space. Chronic diseases are silent diseases, and complications in the form of heart attacks and strokes are too late for Singaporeans to know their health is not in a good shape. Many of the remote vital sign monitoring technology has been clinically proven to have better health outcomes for specific segments of chronic disease patients, but I see two constraints slowing its proliferation in Singapore. One, operational trials to smoothen end-to-end data transmission between patients and primary healthcare teams and care team workflows for responses to anomalies in the vital signs. And two, consent procedures for individuals to decide on the extent of releasing their personal vital signs data to their trusted doctors, public or private, and supporting teams, including community organizations like active aging centers. Both constraints require protocols, even legislation, to be established by the government, with trust and facilitation from the private and public healthcare providers, including GP clinics, as well as the not-for-profit charities providing community healthcare services, to empower more Singaporeans to receive the right knowledge of their health and take charge in managing our own health in an informed way with our care teams. Madam Deputy Speaker, in conclusion, I have quoted the phrase, "health is wealth," several times in my speeches in this House. This becomes a motherhood statement where we talk about but see people around us constantly losing their health with a heart attack or sudden stroke, complications for chronic diseases as our population continues to age. Let us have all hands on deck in a clinically informed, administratively efficient, and coordinated way to ensure that this phrase is the truth for most Singaporeans in the many years to come. Madam Deputy Speaker, I support the motion. Thank you.